Hi everyone, so this is Dr. Go with the monthly Doctor's Talk, and today we'll be talking about managing diabetes in the elderly population. Today's podcast will be divided into two main parts. The first part, I'll be talking about why managing diabetes is much more complex in an elderly person compared to a younger person. And the second part of this podcast will be talking about what an elderly person can do to better and safer manage their diabetes. So on the first part, which is why is it more complex and difficult, more challenging to manage diabetes in an elderly person? So essentially, there are three main reasons. The first reason is that the elderly often have very variable appetite, especially the older that you get, the more health issues you have, the more variable your appetite may be from day to day. And in the treatment of diabetes, right, everyone is given a fixed amount of medications in a fixed regime. And because of that, on days where you actually consume more food or less food, your blood sugar fluctuates. So the risk is usually that we see in elderly folks is that when they take their medications in the morning, and then after that they feel like they have no appetite for the day, but the medication is already taking its effect, right? So the blood sugar tends to drop very low. And this is a very, very common reason why you have elderly people who are admitted to the hospital because of low blood sugar. The second main reason for elderly people why they get a lot of complications is that they often have memory issues. So there have been many times where an elderly person with dementia or even just some very early stages of dementia, they tend to forget that they actually took the medication already. Say they woke up at 8 o'clock, they took the medication, they went out to the garden and do some gardening and came back into the house and they forgot that they actually took the medication already. So they double the dose. And because of this, very often, uh, due to the fact that they took double the medications, the blood sugar typically drops rapidly in about 2 to 3 hours, and they may just experience a low blood sugar. They fainted, and therefore, complications usually occurs because of that. And of course, the third issue is because elderly people have more health issues. So they have issues like high blood pressure, high cholesterol, kidney problems, heart problems, eye problems, and very often this actually complicates treatment goals and it also accelerates the organ dysfunction. So to give you an example, an elderly person might have some kidney problems, partly due to diabetes and partly also due to high blood pressure. And because of this, the goals to control the blood sugar may be more needs to be more aggressive, and because of that, it causes a bit more higher risk of getting low blood sugar. This it kind of sums up the issues why diabetes is actually much more complex in an elderly person. Now, how can we actually make sure that an elderly person is able to manage their diabetes better? So, in a nutshell, managing diabetes in an elderly person requires a lot of vigilance and proactive care. And I think this best sums up what is needed for proper diabetes care in an elderly person. So, vigilance and proactive care. Now, when we talk about vigilance, we need to make sure that the elderly person regularly monitors their blood sugar. So it's absolutely essential. Checking the blood sugar levels at home, keeping a record with a glucose meter. In short, it's called a glucometer, the machine that we use to check the blood sugar, and it helps us to understand how well the body is actually managing the blood sugar throughout the day. And these checks can show if the levels are either too high or too low, both of which may cause problems. And from there, we are able to adjust the medications accordingly. Now, It's also quite essential that the elderly person knows how each medication works. So, for example, if they if let's say they know that okay, this medication is for diabetes, and if I have poor appetite today, I'll just remove this medication from the whole list of medications. So we are able to actually adjust ourselves. The elderly folks are able to adjust on their own, and to remove certain medications when necessary. So to do this, they need to work with their doctor to have a plan for medication adjustments. So the GP will need to explain to the patient, okay, so if you are having not so good appetite today, you can omit this one or you can take half of this. So let's say if you're taking half of your usual portion, maybe you can halve it or you can omit it. Really depends on how good the control of the blood sugar is based on their log. And it is also very much necessary for the elderly person to understand that it is okay to have blood sugar levels slightly high for a short period of time. It's absolutely fine. So it's a much better scenario than having blood sugar levels too low. And the other part of optimizing diabetes in an elderly person, as I mentioned, was proactive care. So what do we mean by proactive care? Proactive care in this sense would basically focus a lot on the diet. So when we talk about diet, the elderly person should avoid skipping meals, as this may actually lead to a very significant drop in the blood sugar levels. So they should eat meals at very regular timing, and also to select food which have a much lower glycemic index. This may sound a bit like a cliche, but it's food with lower glycemic index have a very much more sustained, slow release of sugar into the bloodstream, and it doesn't result in sudden spikes of sugar in the blood or even drops of sugar, blood sugar level. So that's very important. And the elderly person should also stay well hydrated throughout the day, drink enough water, because dehydration may actually also impact blood sugar levels. And lastly, is that every elderly person should and their family members or caregivers should be very well versed and able to recognize the early symptoms of low blood sugar. So the early signs and symptoms of low blood sugar, it could be like just feeling shakiness, feeling a bit dizzy, a bit confusion, a bit having a bit of headache, feeling very irritable. And as the blood sugar levels start to drop even further, they might start to experience like suddenly feeling very nervous or suddenly just sweating very rapidly, and also the heartbeat is just beating much faster. And at this point of time, if action is not being taken, it usually leads to loss of consciousness or just becoming very confused, and then eventually just faints. So it's very important that family members and caregivers or people around the elderly actually recognize the symptoms very early and proceed to just check the blood sugar. It's a very simple, takes less than 1 minute, and just check the blood sugar, and you will be able to prevent a very catastrophic outcome. And finally, for elderly people who have diabetes for a very long time, it could be 10-15 years, unfortunately there will be some degree of damage already done to the body. And it's very important to actually regularly check their health. I would advise probably once every 6 months or once a year. So the thorough health check would include like regular bloods just to monitor the liver, the kidneys, and also maybe some heart examination, some eye examination. And for those who have very long-standing diabetes, they might want to consider proper food care. So check their feet regularly for any cuts, any wounds, or any signs of infection. Because for people with long-standing diabetes, they often are not able to feel these kinds of injuries well. and they might not even know that it existed. So it's very important to check. A very minor injury that is unnoticed may quickly become a very, very serious problem. And also to proactively wear comfortable supportive shoes, socks, so that they don't cut their like cause any minor abrasion or minor cuts in the on the feet, which may result in very, very serious wounds. So in a nutshell, in order for very proper control of diabetes, it's very important to be proactive, as well as to maintain a lot of vigilance in the care of their blood sugar levels and also their medication. So that's it for this month's podcast, and yeah, just please let us know if you have anything that you would like to know more regarding elder care or and medicine and diseases. Be happy to share. Thank you.
Click the share button to send this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.